right, you should be good.
Okay. Good afternoon and welcome to the Insurance and Pharmaceutical Subcommittee of the Health and Government Operations Committee. As we are closing down on this legislative session, we have fewer and fewer bills on our agenda, and but they tend to be the ones that we need to work the hardest on. So, given that, I am going to, if you are here for Senate Bill 773, we are not going to discuss that today, and I will explain why. We are still in negotiations with that bill, and I met with some folks last week, at the end of last week, and they were doing some consideration. I haven't heard back from them yet. So as soon as I hear back from them and we understand, how we can close the gap. It's actually a tiny gap in this bill, but I would like to help us close that gap. And the most efficient way to do it is to get the advocates together and see what we can work out. So 773, we're not going to discuss today. And House Bill 429 and Senate Bill 376 are cross files. And what I'm going to do, and I have the same set of amendments to offer on both of them. So I'm going to go with House Bill 429, Health Facilities, Delegation of Inspection Authority, Nursing Homes. Lisa, you want to tell us what that bill does?
So both of the bills require the Secretary of Health, on request of a county, to delegate to the county the authority to conduct surveys and complete investigations of nursing homes. The amendments that are being proposed for both bills would require that if the Department of Health is 6 months or more behind the federal requirement for conducting nursing home surveys and a county makes a request, that the Secretary of Health must delegate to the county the authority to augment state nursing home survey staff using county funds. The department will have 45 days to initiate an MOU and develop a plan on how to implement the augmentation of staff. The MOU and plan may not restrict a county's progression to the next survey tier if authorized by CMS. The amendment also requires the department to report back to the General Assembly if it enters an MOU, and requires the department to submit biannual reports to each area agency on aging on the number and dates of state surveys conducted in the county during the previous 6 months.
Thank you, Lisa. So what the way the bill came in originally from both of us, it would have required the department to provide authority to do all of the surveys in a county that requested them. And we worked through that. But the issue is, which is an issue that I think there's some complication around understanding, it seems to make logical sense that if the state is paying for the county to do the surveys in the county, that it actually saves the state money. That's not the case, because if they are taking funds out of their operating budget, which I will admit comes mostly from the federal government, they are literally taking the money that they would be paying staff to do the surveys out of the operating budget to completely subsidize the county that chooses that option. So, and that would require the department to lay off people. So one of the things I want to be clear, I want to recognize right off the bat, and I said this in the bill hearing, that OHCQ has been seriously delinquent in completing in surveys of nursing homes over at least the last decade, and probably before that. And part of the reason that this issue hasn't risen to the level of awareness that we have now is the lack of reporting that happens to the county. Montgomery County had an MOU in the early 2000s up until 2019, I believe, that gave them the authority to do that, to do all of the surveys, and they were very successful at it. So that is the reason the bill was brought to us by the county, to say we want to be able to make sure that our nursing homes are inspected in a timely fashion. A lot has changed in OHCQ over the last 18 months, and they have completely reworked their processes. They have hired additional staff. Right now, they have 15 people that they are training. They have, I think it's 45 people who are actively doing surveys, and they are literally catching up in the 18 months that they have had. And I recently received, in fact, just 10 minutes ago, the list of counties and the number of surveys that have been completed in each county. And there is no county, there's one county that is at 47%, that's Prince George's. They've completed, they have 19 nursing homes. They've completed a total of 9 of them. So that's the lowest amount, but I have been, and in Montgomery County, the county that is, that brought us this, they have completed 23 of the 34 nursing homes, bringing us to 68%. Under the old agreement, or under the original bill, Montgomery County would have been paying half for the number of surveyors needed to complete the timely completion of the surveys of their 34 nursing homes. This is a moment in time when we are now passing some of the pension costs back to the local counties. So it's going to be harder and harder for the counties to take this option. Under the amendments that I'm offering today, Montgomery County could, or any county could, decide to hire 2, 3 inspectors, surveyors, which would be a lot less than what we were paying before, and to augment the survey done by the state, and would assure that they would complete the surveys. If they fell behind, they would complete the surveys in those counties. So what the amendments do, provide reporting, so there's a higher level of accountability, and allow for the augmentation, and also allow for, provided CMS agrees, for a county that does the augmentation program to go beyond the structured tier system, so that if the rest of the state was on tier 1, but Montgomery County had finished tier 1 and wanted to go to tier 2, they could, which is the concern that the county raised to me. That is what these amendments do. I see Delegate Johnson. Saw him
Thank you, Madam
first.
Chair. In that report that they gave us, are those all tier 1 inspections, or did they break it down?
There are some tier 2s. Most of them are tier 1. There are 127 total tier 1 surveys in the state, and I'll remind you, there's 220 total nursing homes in the state, and then there are 47 tier 2s in the state.
Okay. All right. Thank you. Because as I understand it, tier 1 is just putting their eyes on the facility.
I'm going to ask Dr. K to explain what tier 1 is.
Thank you.
Yes.
Okay.
So the tiers are, they get to what types of surveys we do. So tier 1 is annual surveys. It's also immediate jeopardies. Tier 2 has to do with high non-immediate jeopardy highs, going out after hours. And so I hopefully, Delegate, you got this data, and if not, I think you should be getting it. you'll see that the tier 1 and tier 2 add up to more than the number of annual surveys, because there's other types. We can go out for complaints, revisits,
I
life safety.
appreciate that, Doctor. If you could just tell us exactly what tier 1.
Tier
what
1
falls
is
in tier
annual
1?
surveys and immediate jeopardies that happen, and any revisits that happen because of those annual surveys.
So what do they do on a tier 1?
Those are the three things.
So they just look at the facility?
No, that's not just looking at the facility. So the annual surveys are
That's
the
what I'm
most,
asking.
yeah, the annual surveys are the most comprehensive. So we're going through pretty
Okay.
much all of the requirements at that facility. So that's what an annual survey is. A revisit is,
Okay.
we found some problems and we're coming back. And then the immediate jeopardy one is focused on the complaint that comes that says, we found something that poses a danger. And so that's much more limited. But the annual
Okay.
survey is the most comprehensive.
All right. Thank you. Thank you, Madam Chair.
Thank you, Delegate Johnson. And Dr. K, I want to clarify how many visits to a facility might a facility experience in a tier 1 inspection?
So in a tier 1, the annual survey is going to take at least about a week, maybe longer. Certainly has been taking longer. Revisits can take 1 or 2 days. It just depends on how many factors. And immediate jeopardy can take anywhere from 1 to a few days. So it really depends on the nature of the complaint, but those are the rough averages.
And I'm going to ask you one more question, and that is, do surveyors go out in teams, or do they go out for the annual survey? Do they go out in teams, or do they go out as individuals?
They go out in teams. So typically, when we're at steady state, about 4 to 5, but right now our teams are larger as we're catching up on the backlog.
Okay. Are there any other questions? Comments. Leslie Frey. Leslie?
Thank you, Madam. Yeah, thank you, Madam Chair. Leslie Fry on behalf of Montgomery
Right.
County. So I just wanted to ask, we're heartened that the amendments allow for the advancing to tier 2 before tier 1 is completed, because it sounds like the department's already doing that in their inspections. So we're looking forward to be able to doing that too. As far as some of the language in the amendment, I just had some clarifying questions that maybe, should make its way into the language. So it says if by July 1, the department is 6 months or more behind in surveys, is that for the county in which the county would be requesting the augmentation? In other words, maybe they're caught up in Montgomery County, but they're still on 47% completed in Prince George's. Does that qualify for Montgomery to then request to augment, or is it just as so long as your county is caught up, that is what we're looking at here?
Good question. Dr. K, want to answer that?
Our assumption was that this was actually for our entire body of work. To come back to a core point, we don't look at it county by county, our data.
Oh, you're
Oh, I'm sorry. Am I breaking it up?
Yeah.
Okay. So we were under the understanding that is looking at our entire set of data for the state. If we wanted to clarify that that's county by county, we'd be open to that, but we don't look at our data from that perspective, right? If one was at 78% and one was at 72%, we're just going through all of our work, right? And so we should be, our goal is that we'll be caught up in a place where that trigger isn't being levied, but that's kind of how we are approaching this line.
And so it would be, thank you. I mean, we're in full support of it being statewide. So it would be just if you're behind on just one annual survey that's been more than 15.9 months across the state, that would be the trigger for any county to request this authority.
So what we're saying is more than 6 months behind the federal standard. So right now we're many more months than that, right? But we are also anticipating that as we're catching up, if we're more than right now, I want to say we're at something like 26, 27 months, something like that. But if we're more than 6 months behind that 15.9 month standard.
So that is an average of all nursing
All.
homes?
Yes.
So how would a county, would you be providing that average to counties along with the data that the bill requires, which is that in the last 6 months, the number and location of the surveys? Because otherwise I don't know how a county would know what your monthly average, what that average figure is.
So, I mean, as part of my assumption is that the data that we are providing will have that, right? Like there's a data sharing requirement in the amendments that Vice Chair Collison offered.
So
Sure,
do
and it
we-
just says the number and dates of the surveys conducted in the last 6 months. That wouldn't get us enough information to be able to know what the average, what that average number is
We
from
can-
that information.
So Leslie, could we get
Mhm.
to that, but by amending the reporting information to include the statewide average?
I think that makes sense, yes.
Lisa, can we do that conceptually? Since we haven't actually moved these amendments, can we add that?
We can work on that.
Okay. But so the concept is that the county will receive the names and dates of surveys in their county and also the average completion rate for the state every 6 months.
Well, to clarify something that Dr. Kalyanaraman just said, they're not breaking it down by county, so I think we should receive all statewide data so that we know if they are in fact behind on the statewide average.
Okay. Is there any question among the committee? What's being asked here? I don't see any. So if that data, we can clean up that language to reflect what the county needs in order to make sure they know when the option is available.
Thank you very much.
Thank you. Leslie, did you have any other questions or concerns about the amendments?
No, that was it. Thank you.
Okay. So I'm going to ask, do I have a motion on the amendments for 429?
Move the amendment. Second.
Okay, and a motion and second. Any more discussion on the amendments? Seeing none, those in favor of the amendments, please say aye and raise your hands. Anybody saying aye? Okay, any opposition to the amendments? Seeing none, can I get a motion on the bill as amended?
Second.
Motion and second, any discussion on the bill as amended? Seeing none, those in favor of the bill as amended, please say aye. And raise your hand. Any opposition to the bill as amended? Seeing none, the bill passes unanimously. Now, for SB 376, Lisa, what's the best way to proceed? Just amend it to conform to 429?
That's fine. They're the same amendments.
Okay.
So moved.
Okay, got a
Second.
motion, do I have a second? Okay, any further discussion? Seeing none, those in favor of Senate Bill 376 as amended, please, I guess we have to vote on the amendments first, right? Let's vote on the amendments first. Those in favor of the amendments, please say aye, raise your hands.
Aye.
Anybody opposed? Okay, no, passes unanimously, and the bill as amended.
Move the bill as amended. Second.
Okay. Any discussion? Seeing none. Those in favor, please say aye, raise your hands. And I've got any opposition to the bill as amended? Seeing none. Bill is unanimous. Thank you all very much. I'm going to get back to you all on Senate Bill 773. But for now, you have 15 minutes before our hearings in HGO. Thank you all very much, and we'll see you in committee.